Boys and girls, we are lucky on this island. It's a small island, but yet we have such wonderful care here for when we are sick. We can go to a special place and get excellent medical care. What's the name of that place?
King Edward VII Memorial Hospital.
Oh, you got it right. You got the whole thing. King Edward VII Memorial Hospital. Let's put some information in the supercharged super screen and get to the hospital and see what happens behind the scenes. Here we go. There, take a look at the screen.
Hello, Learnalots. I know you are interested in seeing what happens behind the scenes in different organizations. Why don't you come to the hospital and let us show you what we do?
Normally, I give them their assignments for the day.
Actually, we wanted to have Professor Nutty's brain check, but he was too busy in his underground lab. And then my Teddy got really sick.
Wait and recess.
Does anybody know what happened to him?
We got shot with a nail.
He was in an accident. Okay.
Yeah.
When someone
One of the few things.
comes to us in an accident, we look at them and we determine whether or not they're awake. Okay, that's very important, whether or not they're awake, whether or not they're able to talk to us and answer questions. Okay, and this teddy bear is awake, so that's great. And then we see that he's breathing well. That's obviously the first thing as well. And he's breathing real good. We look at him. He looks quite healthy. And we say, Mr. Teddy Bear, what happened to you? And hopefully he can tell us, okay? But if he can't tell us, it's very important that people that were there at the scene are able to tell us what happened, okay? So if you're ever at an accident, you want to pay attention to what you see and remember so that we can then look for what's wrong. You're his mother? Can you tell me what happened to him today?
I guess he must have swallowed some of my toys because I left them out.
How big were these toys, Rebecca?
I don't know, about this big.
About this big.
About that big.
And tell me what happened. You were there, the toys were there.
Yeah, and then he had trouble breathing, and then I called the ambulance, and they came and got him.
So did you notice if any of the toys were left there where they were? How many were missing?
Some of them were.
Some of them were there. Do you remember any of the ones that weren't there? Okay. He seems to be breathing fine at the moment. What were the toys made of?
Most of them were solid. Some of them
wood or
toy things.
Were they
plastic.
metal? They were plastic. Okay, well, we can see plastic on X-ray. So since he doesn't have any trouble breathing right now, which is absolutely great, we will send him around for an X-ray to see if we can pick up those items and see where they might be. Hopefully they're little enough and they'll be in his stomach.
Where's the 911 office?
When one dials 911, it goes into Prospect Police Headquarters, and they'll say fire, police, or ambulance. And if you say ambulance, they'll just plug you into us right here at the hospital.
How many ambulances are there in Bermuda?
There's a total of 7 ambulances all total in Bermuda. That's outside of the Navy base, which Bermuda Hospital Board runs 4 ambulances. We run on a 24-hour service. We use 2 ambulances per shift, 2 today, 2 during the evening shift, and 2 during the night shift.
So we have this nice fancy machine now to do his blood pressure, okay? We put this little tiny cuff for him and probably for all young people that come into the emergency room, and we just put it on his arm, okay?
That's good.
And it doesn't hurt. We turn on the machine, okay, and we make it, put it on start, and it just pumps up air. Air comes out of that machine, goes down this tube and into the cuff, and it pumps up tight on your arm. Doesn't really hurt, just feels tight.
I think it hurts.
Well, I guess everyone's perception of pain is different. But most of you have had that done then, huh? Everyone that comes now.
I got that when I hurt my own. They did it
Good.
last month.
Okay.
What does CAT scan mean?
CAT scan stands for, CT stands for computed tomography. So what we're doing, we're using an x-ray tube to take cross-sectional x-ray pictures through the teddy bear to find out what's wrong with it.
How long does it take in school before you can learn how to like use a CAT scan or before you can work with this kind of stuff?
Okay, after you go to Bermuda College, after you complete 13th grade or whatever, you can go to a 2-year associate degree program in x-ray technology. And after you complete that, then you can do specialized work towards CAT scan.
Do you scan all parts of the body or is it just the head?
We scan all parts of the body. The CAT scan was originally developed to scan the head because there was no means of seeing the brain before. But now we scan chest, abdomen, and we scan hips and any part of the body where they're looking for detailed images.
Can you show some of the images from the CAT scan?
Sure, come over here. Again, these are examples of when we scan through a patient's body. All of our bodies look like this. You can see the kidneys, the muscles, the bowel, and here is an example of the x-ray. Again, you have an overall picture with all of the structures superimposed, one on top of the other. When they want to see those structures in detail, we do slices through the patient's body. And that's what tomo means. Tomo means cut. So what we're doing are 1 centimeter sections going through the patient's body so that we can see detail.
No, it's a man. It's
Look at that stuff he's eating. He's eating a mouse.
A rubber band, a computer,
A brush.
computer, not a checkbook, a mouse,
Who's a mouse?
a man.
Dude, and a mouse. What's it about his man? A brush.
Well, let's see. I'm going to scan him and we'll find out what's inside of him, okay?
It's a bullet wound though. What you been feeding him?
They were feeding him.
Why have you been feeding him?
Got a computer, toy.
No wonder he was feeling sick.
Traveling around our beautiful island with the Learnalots program, we sometimes come across locations that are in need of our attention. Here we are today at Spanish Point, and it's disgusting. Bottles, cans, and even chip bags are thrown on this beach. Let's do something about it. Don't litter, and let's clean it up. For the Learnalot program, this is Tony Trash.
Hi. Good. So when do you think you're leaving?
Zoo.
How did you get in the hospital? Bicycle.
How many beds are in the children's ward?
On the children's ward is 26 beds. Sometimes the ward can hold 4, some hold 3, some hold 2, some hold 1. So it varies, depending on what's wrong with the child.
Do you put the same children with like the children who are sick and one, the children who have something wrong with their leg and one?
No. Infectious diseases like diarrhea, chickenpox, measles, 1 in a room. And long-stay patients like Alshay, he got a room with 4 or 5 to keep us company and make him feel at home. 2-room like teenagers.
How often can parents or friends visit them?
Visiting hours in this ward is from 7:30 in the morning to 7:30 at night, and the parents can sleep overnight with their child.
How long does it take to regain the blood that you donate?
The blood is replaced within 24 hours. We take just under 1 pint, and that is as soon as the blood is taken, the body starts to make new blood, and in 24 hours you'll have that amount of blood back. And then the body will work on replacing the quality of the blood cells, and that takes roughly about 2 months.
Do you know how people feel after they donate blood?
Well, most of the time people donate blood, they really don't have any other feeling. They're fine. But it is suggested that they sit down for about 20 minutes or so and have replaced the fluid by having some tea or juice or something like that before they go. But generally there are no after effects from giving blood because, as they say, the body starts to manufacture the new blood straight away. And once in a while people will feel a little faint for one reason or another, but that, even if they do, that really doesn't hurt them. They just rest for a little bit longer. But it's very rarely that that happens.
What's the maximum of time that you can store blood?
Blood can be stored only for 5 weeks. It's usually used within that time because we don't overstore blood, because we can get blood very quickly by having clinics and calling in donors right away in short notice. But it can be stored, if necessary, for 5 weeks in a special refrigerator.
Is there a certain age you have to be to donate blood?
Yes, between 18 and 70 years of age you can donate blood, provided you're healthy. And we do the hemoglobin count first, which indicates the amount of iron in the blood. And then if you have enough iron in the blood, then of course you can give blood. If not, you have to keep the blood because you need the blood yourself.
How important is it for people to donate blood for the hospital?
It is very important for people to donate blood because many of the patients need blood in order to help them get better, or in cases of surgery, they may need blood to be replaced. You may have accidents where people do bleed a lot and need a lot of blood. It's a complete everyday necessity in the operation of the hospital, so donors are very important. And it's a wonderful contribution to the community to be able to literally give life by giving blood.
About how many donors do you have in one day?
Our clinics vary in number according to how much blood the hospital needs. And we can be as few as 6 or as many as 40 or 50 donors in one day. And our clinics are 2 times a week, Tuesday morning and Thursday afternoons.
Right. Have you done this before?
No.
Not at all. All right. I'm going to put this on fairly tightly to start with. And that'll just make sure we get plenty of blood coming through. Now, the next job is going to clean up his fur a bit. All right, so just wipe it with this. And this is the anaesthetic to stop it from hurting. This might sting him a little bit though. All right, so we just put that in. And that might sting. Okay, we'll just throw that away. Now, because this needle's a little bit bigger, but he won't feel it now. All right, all we do is we put that one in. All right. And we hold it there with some tape. And I'll just loosen that a little bit so that his arm doesn't go purple. And there we are. It'll take about 5 minutes.
Well, in this room, this is where I see a lot of children up to 5 years of age from birth who've got any problems with their development. So I work with the parents in here, show them ideas how to help the child move through play to where they should be functioning at. So, so they can get back to school, so they can just continue to develop normally and play like all your kids did. So there's all sorts of things we do, and I've got some setups because we weren't able to get any of my young people in. So say for instance, if a child is learning, say he's about 4 or 5 months of age and he's learning how to develop head control, he might be what we call a low-tone child. So his muscles aren't as strong and help him move through. So we just give him a bit of encouragement and a bit of help along. So we show parents how to position their child to play with them, what kinds of toys, ways to stimulate them. So that of course if you've got something here, he's going to want to put his head up and want to work on his head control. But you've got to keep it fun. It can't be a bad thing, something that the child's going to be scared of. Exactly. They've got to want to do it. So all you're doing is encouraging parents to direct the child, because all kids know how to play. You're just trying to show them how, in sneaky ways. And sometimes the child might need special equipment to help them sit up properly, because even when they're 3 and 4, their muscles just don't allow them to do it. I'll get one of them to sit on it like a horse. Who wants to go on it?
I know.
I guess you all do. Okay. So say for instance, this is to get your balance. What I want you to do is you're a bit tall. Try and keep your legs
Up in the air.
up, well, just like that, but I'm going to try and put your hands just on here to get the start of your head. And I'm going to try and tip you off, because what we're doing is working on your sitting balance, because automatically you know how to correct yourself when I move you to one side, because that's something that's just happened. But if the child is having problems with that, if I went this way, they'd probably keep going. So with games like this, we can teach them how to work on it. Or, if I get you to jump off now. Okay, can you come off this side? The other way is if a child is having problems with either using both of his hands together, or is really, again, what we call low-tone kid, then we do lots of fun things like, I wonder if we could use you. Yeah, just gently. I want you to lay over it like this. And we get something in front, and I want you to support yourself on your hands, and push off, and then push back to me. And then we might get something up in front of you so that your head goes up in the air. So you're working on improving all these muscles through play, which is much more fun. It's like play therapy, that's what we call it. Okay, now come off.
Oh, hi, kids! Remember me? Professor Irvin Mervin Nutty? Well, here again. Once we are in my secret underground lab. Okay, now, have you ever wondered what makes the spectacular colors and fireworks so spectacular? I mean, what gives those fireworks such a great color? Well, I'm going to show you today. It's all to do with chemicals and electrons. You see, these are all different chemicals. Here we have a copper solution. We have barium, lithium, sodium, and lavender. Now, all of these give off different colors, and it's all to do with electrons. The heat in the flame from the fireworks excites the electrons and makes them a different color. It's all to do with energy and electrons. Okay, why don't I demonstrate? Here we go. Hit the lights, boys! Observe the flame given off by a blue copper solution. You see? Nice green flame. All right. How about barium? A bright orange. Look at that. Let's try lithium. An bright red flame. Now let's try sodium. An even brighter orange. Whoa. Look at that. This is lavender. See the purplish orange it gets? You notice that, kids? There we have it. Let's try one more time. Copper, barium, lithium, sodium, and lavender. Okay, hit the lights, boys. Well, another exciting experiment from me, Professor Irvin Marvin Nutty. And I'll see you again next time on the Learnalots.
Cal, we're going to put you in pharmacy this morning, and I think there's quite a bit to do in pharmacy. Will you be pleased with that? Okay, that's great. And then you will receive...
What do candy stripers do?
Candy stripers work under the auspices of the Women's Hospital Auxiliary. They are volunteers. Every single moment they spend in the hospital is a volunteer hour. They work in every part of the hospital, as our pink ladies do, the wards, admissions, CSR, dialysis, the operating theater only on the internal part where the patients come out and they need linen folded. They work in the Gosling ward, which is our children's ward, the extended care unit, and they work at our Agape house, which is our hospice.
How did the program get started?
Well, it originally started in the United States in 1942 during the Second World War, and it was due to the fact that they were very short-staffed in a lot of the hospitals in the United States because most people were out in the war fighting. So they advertised for young people to come in to the hospitals and become volunteers to assist them, and this is how it originated.
What would happen if you didn't have any candy stripers or pink ladies?
Well, I think that the island would be in a state of shock because their hospital bills would be outrageous. The amount of hours that the pink ladies and the candy stripers dedicate to service in the hospital saves the taxpayers a lot of money. We, the auxiliary, put a lot of money back into the hospital pertaining to purchasing equipment. Every single hour that's donated saves all of us because each and every one of us on the island at one time or another will have to come to the hospital for care or for something or other, tests perhaps, and we all benefit by all the hours placed by the volunteers in the service. All right, we're going to put a cast on this wrist here. We're going to pretend that you broke your wrist, aren't we?
Yeah.
Right? What I want you to do is hold your hand out like that. Pretend you're a policeman stopping the traffic. You got to keep your fingers up nice and straight. The next we're going to take is the plaster. It's a nice roll of plaster here. See, the plaster is all impregnated in the roll of bandage here. We just soak it for a few seconds and roll it on like this. It sits up. And now, because I know, how old are you?
12.
12. Because you're a 12-year-old, I want to make sure this cast is good and strong. So I take some fiberglass. Just like anybody seen fiberglass? Your dad's worked with fiberglass on the boat? You take fiberglass and put it over the top like this. How's it doing now? How you feeling?
It's hot.
It's really hot in there? It really does get hot. And when I said before that it got hot, I wasn't putting words into his mouth. I wanted him to say it himself. Like that. It's very difficult to remove a wet cast sometimes because it doesn't want to come off the same way. Do you know what I call this? Jaws. A perfectly healed arm. Is there any mark on there from the saw?
No.
No.
Oh, not that heavy, actually.
Not even that heavy.
Yeah, you can walk in with your arm.
There we go.